That's a lot.
Are there appearance cards on the amendment? We have a few. Have a seat. Katherine Henry. We have a number of appearance cards. So maybe a minute or so, if you could keep it short, that'd be great. Thank you for being here. You're recognized.
Thank you for the opportunity to speak. I'm constitutional attorney Katherine Henry. Unfortunately, my senator left here today. I was hoping to speak on this issue in front of him as well, but I understand duty calls. Speaking of duty, it is my duty, as it is yours, to defend the U.S. Constitution and the Constitution of the state of Florida. I'm going to highlight 3 parts to that. One is the 9th Amendment to the U.S. Constitution, that the enumeration of certain rights shall not be construed to deny or disparage others retained by the people. Number 2, the 14th Amendment that prohibits any state from denying any person equal protection of the laws. And finally, religious freedom as protected in our First Amendment of the U.S. Constitution and Article 1, Section 3 of our Florida State Constitution. Now, many parents or patients for themselves refuse vaccines due to medical, religious, and other reasons. But unfortunately, discrimination in health care based on vaccination status happens every day here. Senate Bill 1270, as amended by 27506, does a few important things, but the sentence that brings me here to testify all the way from Ormond Beach is at line 101. Healthcare providers cannot discriminate based on vaccination status. It's that simple. So with that, I ask you to please remember your duty to provide equal protection of the law and vote yes on this amendment and then on the bill as amended to stop the discrimination happening today that denies medical care based on vaccine status. Thank you.
Thank you. Maija Hahn. Is Maija Hahn here? Good afternoon. You're recognized.
Thank you. Good afternoon, Madam Chair and committee members. My name is Maija Hahn. I'm the Vice President of REACT, a advocacy and charity organization for autism. I am also the lead for Children's Health Defense Florida and the MAHA Florida Coalition for Health Freedom, what represents 11 health freedom organizations supporting this bill and its amendment. I speak as a mother of vaccine-injured children. My son followed the vaccine schedule and had suffered high fevers, Bell's palsy, and regressed into autism. My daughter developed seizures, lupus, tics, and severe ADHD after her 2 months shots. These were life-threatening vaccinations. My daughter's neurologist even warned us to not vaccinate her anymore, but her pediatrician insisted that we continue, and when we refused, we were kicked out of the pediatric office. We were never able to find another pediatrician that was able to take my medically fragile children without all of their vaccines, even though it was the vaccines that had caused those injuries. I had to find a private, out-of-network doctor that was willing to see my kids. This is an ongoing situation. I get almost once a week a family calling me up, asking me where they can find services, medical care for their children because of their either religious objections or because they are vaccine-injured families that cannot cause their children more harm by following what that pediatrician is advising. So this is a very important topic. I have stood on the steps. I used to be in Michigan. I've stood on the steps. I've been in front of press conferences with families that have been deprived organ transplants for their children because they were not willing to get a vaccine that could have caused their medically fragile systems even more harm. These are real stories. These are real people. I ask you to please consider this discrimination is happening every day. People have a right to be informed of their decisions, be part of those medical decisions, and not be deprived of regular health care or organs. The Patient Bill of Rights, VSB 1277, isn't about rejecting medicine. It's about equality and autonomy. It ensures doctors and hospitals cannot discriminate against us, forcing families into impossible choices between care and conscience. Florida's health freedom community represented by MAHA stands united behind this amendment. It's a chance to lead nationally, protecting vulnerable families already burdened by injury and exclusion. I urge you to pass SB 277 with this amendment intact. My children deserve care. Every family deserves access. Thank you for hearing us, and please vote yes and affirm our rights.